What is constipation? When we eat, the food is digested in the stomach and go to the small intestine, which the nutrients in the food such as fat, sugar, and protein are broken down and absorbed. Then, the food residue will go to the large intestine, also known as colon. The large intestine is divided into 4 sections: the ascending, transverse, descending, and sigmoid colon, which connects with the rectum and anus. When stool passes through the colon, most of the water is absorbed, then the stool is transformed from liquid to solid. If the intestinal peristalsis slows down, the longer the transmission time, the more reabsorption occurs, and the stool will become increasingly solid and harder. Once it reaches the sigmoid colon, a final bout of reabsorption occurs, and then enters the rectum, distending the wall of rectum, and telling the internal anal sphincter to relax, and the stool expelled. Everyone's bowel habits are different. The point is, whether the defecation process is comfortable and smooth. In fact, fewer than 50% of people experience the conventional norm of once daily bowel motion. Normally, the frequency of bowel movements can range from 3 times a day to 3 times a week. The bowel movement is smooth without straining, and the stools are not too hard or lumpy, which is considered to be a normal bowel movement. If the number of bowel movements is less than 3 times a week, the stool is lumpy or too hard, and with difficulties in bowel movements, including straining, sensation of incomplete evacuation, sensation of anal obstruction during defecation, or manual maneuvers necessary to facilitate defecation, you may suffer from constipation. Constipation can be classified into 3 types, and they can also occur at the same time. Slow transit constipation. The ability of enteric smooth muscles to contract and relax decreased when aging, and the age-related changes in enteric nervous system lead to the concentration of neurotransmitters reduced. Thus, the peristalsis of the intestine slow down among older adults, and they are more prone to constipation. Defecatory disorder. It results from a lack of coordination between abdominal muscles contraction and pelvic floor muscle relaxation on straining, anorectal structural abnormalities, or urogynecological diseases. It leads to difficult or unsatisfactory expulsion of feces from rectum. In particular, older adults with a lower elasticity of the rectal wall and an increased thickness of the internal anal sphincter will induce defecatory disorder. Normal transit constipation. It is characterized by a normal rate of colonic transit time, with a regular bowel movement, but the patient perceived a difficulty with evacuation. Patients may experience bloating and abdominal pain or discomfort. It is usually associated with irritable bowel syndrome or increased psychosocial distress.